Acupuncture is an ancient form of treatment going back some 2,000 years and one of the longest established forms of healthcare in the world. Treatment involves the insertion of very fine needles into specific points on the body to affect the flow of your body's qi, or vital energy, with the overall aim being to restore the body's equilibrium. Traditional acupuncturists believe that the underlying principle of treatment is that illness and pain occur when the body's qi cannot flow freely. There can be many reasons for this: emotional and physical stress, poor nutrition, infection or injury being among the most common. The British Acupuncture Council has a membership of nearly 3,000 professionally qualified acupuncturists. It is the UK's largest professional body for the practice of acupuncture. Mark Bovey is the British Acupuncture Council's research manager.
Only members of the British Acupuncture Council are in a register that's accredited by the Professional Standards Authority. So that means you have a guarantee of their safety, education and continuing professional development. All members of the British Acupuncture Council are educated to degree level, are fully insured and follow a strict code of conduct.
This film aims to shine a light on the wonderful work being done by members of the British Acupuncture Council around the UK, as well as highlight the growing body of scientific evidence underpinning acupuncture as an effective treatment for a variety of conditions. Rachel Peckham, who is a member of the British Acupuncture Council, is Director and Trainer for NADA GB. NADA stands for National Acupuncture Detoxification Association. In 2017, she set up a NADA clinic at Almanar Mosque in West London, following the devastating fire at Grenfell Tower, to help people in the community suffering from trauma.
NADA acupuncture is auricular acupuncture. It involves the placement of 5 really small, tiny, fine acupuncture needles into 5 points in the ear. Initially it was developed for people that were using methadone to come off heroin with, because they found that the acupuncture helped with withdrawal symptoms and cravings, and just basically helped with the anxiety that there is around using. Over the last 15-20 years, the use of NADA has been more widespread. It's being used in trauma, so in PTSD. It's been used in cancer care for helping people with side effects from medications that they've been given. It's been used in kind of more general mental health issues, because obviously addiction is a mental health issue. And in some countries like Sweden and Germany, they use it in psychiatric care to help people come off prescribed medications or instead of prescribed medications.
When Rachel set up the clinic at the mosque, she drew on learnings from a similar NADA clinic that was established in 2001 after the Twin Towers terrorist attack in New York.
But they found there that people who were coming in, they had other services there as well. They had counselling, they had other forms of energy work, energy healing. But they found that a very large percentage of people opted to have the NADA treatment, the acupuncture treatment, compared to a very, very low percentage of people that preferred to have counselling. People found that it just helped with the anxiety, it helped with sleep, it helped with the trauma that they'd suffered. So this is something that's obviously affected the whole world, but it's something that we thought of when the Grenfell fire happened.
British Acupuncture Council member SAMINA HAIDER is one of the volunteers at the centre.
Obviously a lot of people who have been victims of the Grenfell disaster have quite a lot of severe PTSD, general stress, insomnia, back pain, high blood pressure. It's quite varied, and the treatments just allow our patients to come in and have a bit of a reset. I think, you know, if they're struggling with pain that day, they have this moment just to be able to completely relax into the treatment, and they feel quite rejuvenated, I say, when they leave the sessions.
The practitioners don't delve into each individual story by asking lots of questions.
Sometimes the trauma is just too much to verbalise it. So the beauty of the clinic and the treatments that we provide is that it's a non-verbal process. It allows them, as mentioned before, it allows them to reset for that moment, allow them to take stock of what's happened, and actually by talking to one another, it allows them to have a shared experience of been able to work through what has happened to them, realise what's happened to them, and be able to process it.
Before I have a severe pain in my neck and in my back here. But sometimes when I get up in the morning, I feel my neck is stiff. I went to a lot of time to my GP, and he always give me ibuprofen. Just take ibuprofen. But when I start acupuncture here, I benefit from it, and I feel better and relax, and the pain is gone.
And we think that aside from the physiological effects of the acupuncture, there are also the energetic effects of many people being almost in a meditative state together, as well as the psychosocial effects of people coming in and we're all in the same boat.
Published research has also shown the benefits of NADA for cancer treatment-related hot flushes. It is practiced by acupuncturists at the Fountain Centre in Guildford. The Fountain Centre, situated in St Luke's Cancer Care Centre at the Royal Surrey County Hospital in Guildford, is an independent charity founded in 1998 by a group of radiotherapists who recognised the importance of treating patients holistically, focusing on their emotional, social and psychological care alongside treatment provided by clinical experts. The centre successfully piloted and evaluated 3 8-week NADA clinics. Natalie Silverdale is Research and Development Manager at the Fountain Centre.
We started off with a group of 10 women and 10 men. We provided this clinic, and every person turned up every week, which is really, I think, shows not just how important the service was in terms of for the symptom treatment, but also in terms of the social, kind of like the social support that gave people.
A total of 74 women and 40 men have now used the service. The majority reported that their hot flushes reduced by at least half at night and by 35 to 40% during the day.
Some people got complete relief from the hot flushes. There were a few people that it didn't work for, but for most people they got a significant improvement in their hot flushes.
61-year-old Paul Gilbert was diagnosed with stage 3 prostate cancer in December 2017. He began treatment straight away. This included injections of the hormone therapy Zoladex every 12 weeks.
I've been on that since the 29th of December 2017, and I have suffered with horrendous side effects from day one. Within a week of that first Zoladex, I started getting hot flushes. My emotions went everywhere, very sore nipples, just mood swings, everything, you know. But the hot flushes were the one thing, it was the sleep deprivation.
Paul has just completed his 8th and final session of NADA group acupuncture at the Fountain Centre.
I had the acupuncture, and I don't get hot flushes at night anymore. I still get them during the day, that's manageable, but my sleep's improved, everything, you know. I feel so much better. It is literally chalk and cheese for sleep. It's just amazing. Anybody that has hot flushes, have acupuncture. It works.
British Acupuncture Council member Libby Temperley-Shell is one of the volunteer practitioners who works at the Fountain Centre each week.
Cancer strikes all people. It doesn't matter whether you're wealthy or poor, it will darken all doorsteps. I have 3 appointments in the mornings when I treat, and people often come in, they've been across the corridor for their treatments, and they're often very brutal. People come in, they're exhausted, they often have very strong side effects of nausea, feeling hot flushes, often terrible pains in their joints. All of these compounded with the fact that they're very poorly. I greet the patient in the lounge and I bring them through into the treatment room, and we sit down and we have a little chat about how they're feeling. They tell me about their symptoms, and of course they tell me about where their cancer is. So I always listen to what they want treated, whether it's hot sweats or whether it's the pain in their knees and their feet and their hands that they're suffering from. And then as a Chinese medicine practitioner, I use the diagnostics of feeling their pulses, and I look at their tongues, and then I sort of put together a treatment. When they feel relaxed, then I will put in needles according to the diagnosis that I've made. Then I'll leave them to relax for a bit, and often they will fall asleep, sometimes snore. At the end of the treatment, I will take their pulses again to make sure that the treatment I've given them has done benefit to them. Take their needles out, and then they get up, we have a quick chat about how they're feeling, and then I wish them well and off they go.
The research shows it works, which is a big thing. Acupuncture does help with symptoms and issues concerning cancer.
Increasing numbers of medical doctors are beginning to look beyond their traditional medical training and consider other forms of healthcare. Dr. Sanjay Gupta is a consultant cardiologist and heart specialist working at York Teaching Hospital. He's about to embark on a clinical trial he's designed in conjunction with the Northern College of Acupuncture, looking at the role of acupuncture in the management of atrial fibrillation, a heart condition that causes an irregular and often abnormally fast heart rate.
It has become very apparent to me that there's something wrong in the way we do things. The first thing is that the NHS itself is not really a healthcare service anymore. It's a sort of symptom management service. I think a lot of the problems that we see are lifestyle generated. We all lead very stressful lifestyles. We eat the wrong food. We don't exercise enough. We're all stressed. We don't sleep enough. And so when a person presents with a complaint, we choose to see that problem as a disease. And we don't link it back to the fact that it may have something to do with the patient's lifestyle. So when you see it as a disease, what you do is you try and manage it as that, you treat it as that. But if it were a symptom of something else, then what you miss is the whole underlying pathology that may have caused this, right? So it is a little bit like applying a sticking plaster and not treating the root cause.
Dr. Gupta was particularly influenced by an academic paper he read during the course of his work.
I came across a really interesting study published in 2012 by a chap called Lombardi. And what they were interested in was looking at the role that acupuncture could play in patients who suffer from this condition called atrial fibrillation, which is what I'm interested in. And they did a small study, but very interesting, in that what they found was that if you administered acupuncture to a bunch of patients who'd had atrial fibrillation and had gone through treatment for it, the recurrence of atrial fibrillation got a lot less with acupuncture compared to nothing. It was almost as effective as giving them heavy-duty heart rhythm controlling medication, which inherently comes with its own side effects and is not completely risk-free.
Having read the research, he wrote about how promising he felt the role of acupuncture could be. He was subsequently approached by the Northern College of Acupuncture, who were interested in a collaboration.
We got together and we've collaborated, and we've designed a trial which is going to look at the role of acupuncture and also self-management. So not just the administration of acupuncture with needles, but actually the idea of sitting and talking to the patient, going through their diet, working out whether they're using stress management techniques, etc., in the hope, and if you can take this cohort, compare it with the cohorts of patients who don't do that, then it would be interesting to see whether we see a difference in outcomes. I suspect we will.
I've seen it work, I know it works, and the alternative, apart from people actually putting up with it, is drug treatment. And drug treatment has more side effects. So you give a drug, and you give a drug to help with a drug, and where do you stop? And what you don't want to do is to be giving these patients any more drug treatment. They've had enough. They'll probably had chemotherapy, they might have had radiation. So to offer them a treatment that does not involve drugs, which is effective, is extremely valuable.
Acupuncture can be helpful, partly because it does relieve symptoms like pain, but also I think there is there's a different kind of connection that you make with the patient. There's more time to sit there and talk to the patient, and I think that connection can be extremely valuable. It's a much deeper and longer in terms of duration than your standard consultation. I mean, acupuncture works. It doesn't work for everybody, but it can be extremely effective in some patients where our standard medicines don't seem to be terribly effective. And for that reason, I think acupuncture should be available in the NHS.
What would be the benefit to the NHS? Well, benefit to me is that I have happier patients, and I can see more patients, I suppose. You could say that would actually speed the throughput of patients. Patients that are happy, patients that are comfortable, need less of my time. They also need less in the way of drug treatment. They will go to their GPs less often. And that's aside from the moral and ethical importance of returning people to their lives after they've been treated, which is what we do as doctors. Our job is to return these patients to their normal life, whatever that is. Basically, we don't want to have to see them. We want them to be better. I think this is an important political point that needs to be made clear, is that here is an area that it could be delivered cheaply and benefit patients in many ways, as well as making it easier to run a health service.
Dr. Beverly de Valois is a widely published research acupuncturist who has carried out several pioneering clinical studies into improving the quality of life for people diagnosed and treated for cancer. For the past 20 years, she has worked in the supportive oncology research team at Mount Vernon Cancer Centre, which is part of the North and East Hertfordshire NHS Trust. One of her studies looked into the use of acupuncture to improve the quality of life for people with lymphedema. The study was published in Evidence-Based Complementary and Alternative Medicine in 2016 and was funded by the National Institute of Health Research as part of its Research for Innovation, Speculation and Creativity funding stream.
It was very exciting to be awarded the NIHR grant to use acupuncture to manage well-being for people with lymphedema, and we were probably amongst the first people in the world to do this in a study.
Lymphedema is a swelling in the tissues caused by damage or disruption to the lymphatic system.
This is a chronic, lifelong condition. Once you've got it, it's very unlikely that it will go away, and it remains a threat for the person's entire life.
The aim of the study was not to treat the lymphedema itself, it was to improve the quality of life. But, as Macmillan lymphedema nurse specialist ELAINE MELSOME, who worked with Beverly on the trial, explains, the results were quite surprising.
We found that the patients perceived there had been improvement in the size of their limb, even if there wasn't a measurable reduction. And this led them to feel more positive about the condition. It increased their self-management and it reduced their anxiety about the condition.
Mother of five, Val Fear, was referred to the trial by ELAINE. Val was diagnosed with breast cancer 2 days before Christmas in 1999. She had a lumpectomy in January 2000, followed by chemotherapy a month later. She developed lymphedema almost straight away, which had a very significant impact on her life.
Emotionally, I found it hard because my arm looked so different. It was very swollen. My fingers were like sausages. People were constantly asking me what was wrong with my hand. Buying clothes was a nightmare because one arm was at that point 40% bigger than the other. And I also was having a lot of nightmares. From the time I started the chemo, I was having some very bad nightmares. Wasn't sleeping, frightened to sleep, and I wasn't eating properly. So it was not a good time in my life. It wasn't good at all.
She had just so many adverse consequences as a result of her cancer experience, but also the lymphedema. Just her journey through that study was, and what I learned from her has been kind of a big inspiration in my life and a big inspiration for how people with cancer can respond to acupuncture.
For Val, the treatment was life-changing.
It didn't hurt. I expected it to hurt. I expected just occasionally when Beverly put the needle in, she'd wiggle it a bit to make sure she'd got the right spot, and it was a funny, tingly sensation. But it relaxed me and it made me feel very calm, and long term, I benefited so much from it. I started to sleep properly, the nightmares stopped. I've gained so much from the acupuncture. I regained my self-confidence. I always felt as though there was a monkey on my shoulder, and every now and then he came out and he slapped my face when the lymphedema flared. And he's still there, he always will be, but I just slap him back now, and I can control him instead of he controls me, and lymphedema doesn't rule my life anymore. Oh, if you have the chance, try it. You've nothing to lose and absolutely everything to gain. It will change your life.
Professor Hugh Macpherson is a professor of acupuncture research at the University of York and has been practicing acupuncture for 36 years. Over the past 20 years, he has conducted high-level research into a variety of conditions.
The area I got most interested in were those conditions where GPs feel they're not very effective. So chronic pain is up there, depression's up there, irritable bowel syndrome. These conditions became the focus of my research.
Professor Macpherson has conducted a number of randomised controlled trials, including ones for lower back pain, chronic neck pain, depression and irritable bowel syndrome.
In our low back pain trial, we had 240 patients and randomised them either to acupuncture, 10 sessions, or to usual care. And what we found was clinically significant and statistically significant benefits at 2 years after this course of treatment. Benefits in the acupuncture arm that weren't experienced in the usual care arm. So in this trial and the other trials, we work with local GPs. The GPs refer their patients into the trial, so they're everyday patients.
Professor Macpherson has also carried out long-term research into the effectiveness of acupuncture in treating depression.
A lot of people are on medication but are still depressed. And there's a question is, to what extent can acupuncture help? That was our research question. And we recruited 750 patients over an 18-month period and randomized them to either acupuncture or counseling or usual care. And then we tracked those patients after 12 sessions of acupuncture. And what we found was clinically significant and statistically significant benefits at 1 year. That group of patients were typical of the patients that are consulting in primary care with depression, but are not getting benefit from medication. So what we found was, that group of patients actually did rather well with acupuncture. So acupuncture should be a referral option among GPs. They would be happy to see their patients getting better, especially those on medication who are still depressed.
Acupuncturist Rebecca GIANTY opened the Treat Norwich multi-bed clinic in 2016.
A multi-bed clinic means more than one person having acupuncture at the same time. So basically we have about 10 to 15 minutes to chat with the patient, take their pulse, do tongue diagnosis, then we get them on the couch, put their needles in, and while they're relaxing, we then move on to another patient.
There are a total of 4 acupuncturists at the clinic who treat between 65 and 70 patients per week. Rebecca's mission is to bridge the gap between acupuncture and local health professionals, especially GPs.
What we really like to do is to capture the cases where they're really struggling and we bring them in and go, hey, we're here, we can really support and help you. While you're waiting for the wait times on the NHS, that's the gap we seem to be filling, particularly for chronic conditions.
And a multi-bed clinic treats the same conditions that a private acupuncturist would treat, such as sciatica, lower back pain, migraines, mental health disorders, and chronic conditions including irritable bowel syndrome and urinary tract infections. Jade Newbold went to see Rebecca and her team at Treat after suffering several miscarriages.
I was falling pregnant okay, but I was miscarrying at around 12 weeks. And I had tried the various diets and various bits and pieces, but each time it wasn't really happening for us. And it's absolutely heartbreaking because you get your heart set on it and you're really excited. But I feel that the proof is in the pudding when the sonographer who'd been through my 3 previous miscarriages said, what have you done different? And I said, the only thing I've done is had acupuncture. And she said, it's actually the blood flow to the uterus. The wall, the lining was a lot thicker. It looked like a better, more viable situation. And obviously I'm 41, I'm kind of cracking on in terms of age. And she said to me, uterus of a 21-year-old. I was like, okay, yeah, that's a good advertisement for acupuncture for sure.
Jade now has a beautiful, bouncing baby boy, and she couldn't be happier. 67-year-old former civil servant Julie MILTHORPE was suffering from debilitating arthritis in her feet, ankles, knees and hands.
Walking was difficult. I was wearing splints on my hands the whole time, and there was a lot of pain. I tried a whole variety of anti-inflammatory drugs, including methotrexate, the sort of things where you have to have regular blood tests because they can upset other things, and was also on pretty strong painkillers. When I started acupuncture, I was on 2 grams of paracetamol a day, and also the maximum dose of quite a strong painkiller called tramadol. I had to set aside being sceptical and just give it a chance and be open-minded about it. But gradually, things got better. The pain was lessening, and I'd got more movement. My walking was better, my hands were better, and now I've got rid of everything except the orthotics in my shoes physically, and I don't regularly take any painkillers, and I'm down to just one fairly simple anti-inflammatory drug as well.
Professor Hugh Macpherson believes that acupuncture should be considered as a valid alternative to non-steroidal anti-inflammatory drugs.
If you look at the evidence, acupuncture has a similar effect size to non-steroidal and anti-inflammatory drugs, but has long-term effects and has no side effects, doesn't have the worries about gastrointestinal bleeding, for instance. Research into non-steroidal anti-inflammatories in the UK shows that 2,000 people a year die from taking regular dose of non-steroidal anti-inflammatories that wouldn't have died if they hadn't been taking those drugs. And they're taking a regular routine dose, but for a longer term than they should be. So opiates are stronger than acupuncture in terms of effect, in terms of clinical effect. We know that. But all the addiction problems with opiates, you don't see that with acupuncture.
A systematic review carried out in 2011 analysed acupuncture treatments from babies to children over a decade and concluded that acupuncture is safe for children. Rebecca Avon has been in practice for 20 years and is the author of the textbook Acupuncture for Babies, Children and Teenagers. In 2012, she founded the Panda Clinic, where she treats up to 30 children a week for a variety of different conditions.
Acupuncture, because it treats the whole person, can be effective in an enormously wide range of conditions, some of which Western medicine struggles to effectively treat. It also has the benefit of having negligible side effects, virtually no side effects. It's very well tolerated by children. They tend to enjoy their treatment. And very often, as well as the symptoms for which they came improving and hopefully going altogether, the child often feels better in themselves, and children who are ill come to be so defined by their illness, and that has an enormously negative effect potentially both on their emotional and mental development, but also it strains the family. So it's just lovely when you successfully treat children to see the burden that's lifted not only from them but from the rest of the family as well.
10-year-old Alice Taylor has suffered from recurrent urinary tract infections for most of her life. Her mother, Alison, eventually decided to try acupuncture to help her cope with the infections and reduce the number of antibiotics she was taking.
We came to see Rebecca when she was at the point where her condition was chronic, and the bacteria had actually embedded itself in the lining of the bladder, so it forms a biofilm infection and it keeps coming back and coming back and coming back, and it's very difficult to treat with short courses of antibiotics. I didn't think it would have as many benefits on her holistically and on her whole well-being as it has done, because lots of children with chronic illness, it affects them on so many different levels, not only levels of pain, but emotional well-being and psychological well-being. And Alice always remained very strong when she was in a dark place. And I think that was the acupuncture. It really helped her.
The paediatric conditions that have been most thoroughly researched and for which the evidence is the most promising range from pain to cerebral palsy, bedwetting, respiratory disorders, problems related with autistic spectrum disorders, lazy eye, post-operative nausea and vomiting. There's also research for tic disorders and digestive disorders. And in recent years, there has been an increasing amount of evidence to show that acupuncture is very effective in treating mental health conditions.
Acupuncture is really effective at treating depression and emotional disorders. And actually, I would say that's one of the most common reasons that older children and teenagers seek acupuncture treatment.
16-year-old Rafe has been having acupuncture with Rebecca for 2.5 years to help him deal with anger problems and low self-esteem. Both were having an impact on him at school, and he was falling behind academically.
School were throwing techniques and kind of just solutions that just were not helping him, and I just noticed his confidence and his self-esteem was dipping, and there was nothing to help, literally nothing to help.
I pretty much didn't have a phone for 2 years. The amount of times I got in trouble, it was just unreal. And then ever since I've been coming to acupuncture, I've pretty much only had my phone take off me 3 or 4 times now. Before treatment, I always feel like maybe hot and just angry and just snap at anything, at any little thing. But then after, I just feel like cold and like chilled. I just feel like tired and just pretty much knackers me out, really.
I remember coming to acupuncture and saying, Rafe is like a tsunami in my house. He used to just crash like a massive great big wave through the house, and it would impact on everybody and obviously him too. And now he feels like a serene river that goes around and then negotiates boulders, and then he has a little bubbly brook, and then he's a little bit of a beautiful waterfall, and then he's a little bit more of a serene river. And that is exactly the transformation I feel when I think about Rafe and how he's transformed.
Traditional acupuncture is growing in popularity as more and more people experience its health benefits. The British Acupuncture Council is keen to bridge the gap between traditional acupuncturists and the Western medical community, and increasing numbers of scientific studies are demonstrating that traditional acupuncture is especially effective when used to complement various aspects of Western healthcare.